Hey everyone, welcome to another video. This is the third part of the diabetes lectures. We already did an overview of diabetes and diabetic acute complications. Today we are doing diabetic chronic complications. So if you haven't seen the previous video, I'll link it down below. Before we get into it, do not worry about your study notes because they are on nursingjournal.com. Okay, you will find everything there. And if you want to stay updated with my videos, subscribe to my channel or follow me on social media. But let's get started. So today we are discussing chronic diabetic complications, okay? And with chronic diabetic complications, there is one thing you have to keep in mind, and one thing that is the whole cause of the problems, and that is diabetes damages blood vessels. And this damage has no limit, okay? It will damage small blood vessels, it will damage big blood vessels. So any blood vessels in a diabetic patient's body is going to be affected, okay? And this effect, this damage is going to happen over the years. So this is why they are chronic. Your patient will not get diabetes today, boom, complication tomorrow. That's not how it works, okay? These issues are chronic, so they will happen over years of having diabetes. Let's split them into two to make it easier for you. Microvascular complications and macrovascular complications. Micro, small, tiny, so the damage to the small blood vessels. Macro, big, so the damage to the big vessels, okay? So let's start with micro. So microvascular damage can occur in quite a few areas, but we're going to focus on three. There is a condition called retinopathy, a condition called diabetic nephropathy, and a condition called diabetic neuropathy. So with retinopathy, what happens is that the blood vessels attached to the retina, which is found inside your eye, will not get enough blood flow, okay? So that means that the retina is not getting enough oxygen and blood flow that it needs, and so it will start to deteriorate over the years. The first symptom will be a blurred vision, but if this is left untreated, it can lead to blindness or visual disability, okay? The second issue is diabetic nephropathy. What happens here is that the blood vessels that are attached to the filtration system of the kidneys, aka nephrons, they again do not get enough blood supply, do not get enough oxygen because they are damaged from diabetes, and so the filtration system will not work properly, okay? Over years, this filtration system will start to fail, and that will cause kidney failure, okay? And if left untreated, your patient will need dialysis or a kidney transplant. And the last micro complication is actually diabetic neuropathy. And neuropathy is basically damage to the nerves. Again, the blood vessels are damaged, so they do not supply the nerves with the oxygen that they need, right? And so nerve damage can occur anywhere in the body, most commonly in the extremities. So feet and hands, they will start to lose sense, so they will become numb, okay? And in diabetic patients, it is very common to actually hit their foot, burn their hand, and they won't notice right away, okay? Because they do not feel the pain, they do not feel the burning sensation, right? But nerve damage does not end there. It can also affect other nerves in the body and cause quite a few problems. So with macrovascular complications, what we are referring to is actually the damage to the large blood vessels, and the main issue here is cardiovascular disease, okay? Patients with diabetes are at a higher risk of having a cardiac arrest or heart attack or having a stroke, which is no blood to the brain, okay? And research has actually shown that these patients, like diabetic patients, are more often overweight, they have a high blood pressure, and a lot of the time they have high cholesterol levels. So all of this together with the damage in the blood vessels can increase the risk of cardiovascular disease, okay? And the second part of macrovascular complications is actually having the diabetic foot issues, okay? And diabetic foot ulcers and wounds are very, very common in diabetic people because, as we said before, they have a lack of sensation in their extremities, okay, in their feet and in their hands, and they also have a lack of circulation, okay? So pairing it all together, it goes something like this. So diabetes causes damage in the blood vessels. The blood vessels do not give enough oxygen to the extremities, the nerves, so the nerves do not have a good sensation. Pairing that with a bad circulation is going to give us the best recipe for disaster, okay? So patients with diabetes are at high risk of having problems, of having wounds in their feet, okay? And if you might notice, it takes a lot longer for these wounds to actually heal. Again, for the whole same reason, there is a lack of circulation, lack of oxygen in that wound, so it is going to take longer to heal, which might make it more susceptible to infection, okay? So it's a bit of a really bad situation. The wounds do heal. There is a lot of dressings that can be done, and with antibiotics and with excellent nurses, the wounds will heal very well, but it will take a lot of time. So prevention is key. Having good foot care and encouraging and educating your patients about their health is insanely important. So that is all for the chronic complications, okay? Thank you so much for watching. If you enjoyed the video, hit thumbs up and subscribe to my channel. If you have any questions about topics that you have for your exams, please message me on one of my social medias. Until then, ciao!